पाइल्स या फिर एनी एनोरेक्टल सर्जरी आर यूजुअली परफॉर्म्ड अंडर स्पाइनल एनेस्थीसिया एंड स्पाइनल एनेस्थीसिया का एक नोन साइड इफेक्ट है पोस्ट स्पाइनल हेडेक. What is post spinal headache? Well, headache which is usually exaggerated on standing or sitting up from a lying down position within 15 minutes. It is usually associated with neck stiffness, back pain, blurring of vision, or even nausea or vomiting. The time period of manifestation is usually within 48 hours to 72 hours after surgery. And the best part of this problem is it's a self-limiting disease. मतलब the symptoms usually subside within 5 to 7 days after surgery. But if the symptoms are severe, how will you manage it in the home? Well, it can be managed by maintaining an adequate intake of liquids, minimum 3 liters per day, and avoiding a pillow while you are lying down. Still, if these measures doesn't work, then you can consult your operating surgeon and I will give you an analgesics for the relief. Before undergoing any anatomical surgery, let it be hemorrhoids or fissure or fistula, almost all of my patients ask me this question very oftenly: sir, will I be able to have motion, or I'll be able to pass stool normally after surgery? Well, my answer is, see, if the surgery is being performed by a qualified, experienced surgeon, you don't need to worry at all. I'm not saying you won't be having zero discomfort or pain after surgery. You will be experiencing some amount of pain or discomfort in the initial 4 to 5 days after surgery, but there are certain measures which I ask all of my patients to follow, such as sitz bath, application of an anorectal ointment before and after going to the toilet, and with these measures they are able to have motion in a comfortable way. And also, it's normal not to have any motion for the next 2 or 3 days after surgery. It can be attributed to multiple reasons, such as number one being a patient remaining empty stomach on the day of surgery and decreased oral intake for the next 2 or 3 days, then fear of going to the toilet. One more reason can be patient being non-ambulatory. The patient patient remains to the bed for a very long period of time immediately after surgery. So if you're not having motion in the next 2 or 3 or even 4 days after surgery, don't be afraid. That is normal. Usually most of the doctors advise laxative after surgery, and almost all of them do have motion after 2 or 3 days. But if it is delayed for more than 3 or 4 days, then do consult your doctor. Last but not the least, it is very important to stay hydrated in the post-operative period for various reasons. Number one being the anesthesia medicines tend to remain in the body for a certain period of time after surgery. So if you maintain an adequate liquid or water intake, this helps in flushing out these medicines. Number two, it helps in preventing the post-spinal headache, as I had already mentioned. And last, it helps your digestive system to work in a more better and efficient way, and thereby preventing the unwanted digestive system side effects such as bloating or constipation.